one nation, under God, indivisible, with liberty and justice for all.
Thank you very much, Doctor. Approval of minutes. There are no minutes for this evening. Citizens' time. Is there anybody either here or on the line, Sarah, who would like to speak to this board who are not on the agenda? I'm seeing no. We'll wait a couple more seconds. Nobody? And we will move on to Chairman's report. Tonight, I'm Ed Weiner and I'm Chairman, and remote with me are board members, Vice Chair David McSweeney and Dr. Wayne Saltzman. Also with us tonight is Susan Luminello, our Director of Public Health, Marlene Johnson, our Health Agent, Christine Mathis, our Environmental Engineer, Sarah Quartermash, Lead Administrative Assistant and IT Host. I have a new title for her every single meeting. And Dawn Cathcart, our outstanding recording secretary. Thank you all to the outstanding BCAT professionals who work so hard to make this program and many other news programs within this community possible. We still are operating in a declared state of emergency with special rules for meetings. Mr. McSweeney, Board of Health Vice Chair, will provide the legal requirements for tonight.
Thank you, Mr. Chairman. Pursuant to Governor Baker's March 12th, 2020 order suspending certain provisions of the Open Meeting Law, General Law, Chapter 30A, Section 20, and the Governor's March 15th, 2020 order imposing strict limitations on the number of people that may gather in one place, this meeting of the Burlington Board of Health is being conducted via remote participation. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings as provided for in the order. A reminder that persons who would like to listen to or view this meeting while in progress may do so by tuning into BCAT Government Cable Access Channel, the BCAT Government Meeting Facebook Live feed, or over the telephone at 408-418-9388, meeting number 129-926-9769. Again, phone number 408-418-9388, meeting number 129-926-9769. Also, we will be monitoring the comments on Facebook Live to see if there are any that the board may wish to address live. And as a reminder to all board members that votes are required to be done by roll call. And with that, I'll turn it back to the chair.
Thank you, Mr. McSweeney. Sarah, I did some things out of order by error. And why don't we wait another 30 seconds or so to see if anybody logs on? Thank you. Has anyone logged on, Sarah? No. Is it citizens' time? No. Okay, good. Again, we are live on BCAT and available for comments and questions through this video technology. And as I note at every meeting, remote meetings and chairing remote meetings are not easy. Preparation is many times that of an in-person meeting. Please understand we're doing the best we can, and we're all in this together. It's been quite a year. The COVID pandemic has put our lives on hold in many ways and continues to be difficult. But for this board, things have not changed. We, our professionals, our members, continue to do nonstop what needs to be done, working to keep this community safe in so many ways. I pretty much have, that's my report, but I just want to make an announcement. Yesterday I met Michelle Nicole, which is our new administrative assistant. Sarah Quartermash no longer has to do it day after day, go it alone in the office that clearly needs two administrative professionals. Sarah, thank you. I don't know how you did it for so long. I don't think we have a long meeting tonight, so I think we should go right to our business, which is X Golf, 10 Wall Street, external grease interceptor. And presenting that will be our health agent, Marlene Johnson, and we have the proponent here, John Langevin.
Yes.
So just to give you a little bit of background, X Golf, their primary business is indoor golf simulator with food service. And the type of food that they plan to offer, I did have a menu, it didn't print that great, but basically the food is pre-cooked, it's frozen, and then it's reheated on site. So there's not a lot of food prep that will take place at the establishment. Mr. Langevin is requesting a variance from Section 4, Part A, the installation of an external grease interceptor. The variance application is provided for you, and my recommendation to the board is to vote to approve the variance from Section 4, Part A, and allow the new food service establishment to operate without installing an external grease interceptor with the following condition. The food service establishment operator and the property owner both understand that this variance may be subject to revocation, suspension, or expiration as determined by the Board of Health. A variance under these regulations may be revoked, modified, or suspended only after the food service establishment has been notified in writing and given an opportunity to be heard at a regularly scheduled meeting of the Board of Health. Reasons for revocation, modification, or suspension of a variance include, but are not limited to, a determination that the food service establishment is discharging grease in quantities sufficient to cause sanitary sewer line blockages or increased maintenance of sewer lines.
Mr. Langevin,
Yes, sir.
please understand that this is a big deal. Even though you're not going to probably produce a lot of, Dr. Saltzman, fog?
Yes, we use the term fog for fats, oils, and grease, Mr. Chair.
Thank you very much. We still had a major issue over last week, and we still on occasion have problems with fats, oil, and grease. And even though you're probably not going to produce a lot of it, you still need to follow the rules and regulations, and that is, for the most part, to empty it, to keep it maintained, and to keep your logs up to date. And if you don't keep your logs up to date, and it's probably in the back of your mind, you better put up some type of a schedule, or you will have our health agent on your back, and you don't want that to happen. She is a very tough professional. So with that, my other two colleagues, Mr. McSweety or Dr. Saltzman, do you have any other comments?
No, I have no comments. Not keeping your log, sir, is you might as well take a mulligan. That's what I'm saying. Mr. Chair, I have no concerns, and I wish to make a motion to approve the variance for an external grease trap as described.
I'll second that motion.
We have motion and a second. Mr. McSweeney, do you have any comments?
No, I once we get through the vote, I'd love to hear more about the business, but no comments.
Then I'll put it to a motion. All in favor, Mr. McSweeney,
Aye.
Dr. Saltzman,
Aye.
and I vote aye. It's 3-0-0. So all I can say to you, Mr. Langevin, is 4. Mr.
Thank
McSweeney,
you
you
very
had a
much.
question.
Yep.
When is it?
No,
When is the company opening?
Yeah, when are you opening, and what do you? Obviously, it's indoor golf, but do you have other locations? Love to hear a little bit about you.
Sure. Happy to.
Excuse me. This is your one chance as a commercial.
Okay. No. Thank you for that. And actually, I've become known in with the planning board and with the board of selectmen, where I recently had to get approvals of a variance from the planning board and also of a liquor license from the board of selectmen, which was approved last night. So I'm ready to begin construction of my building. I'm going to be located at 10 Wall Street, which was formerly Chuck E. Cheese, that location. They occupied, I think it was about 11,000 square feet. I'm taking about half of that, 5,500 square feet in that building. X Golf is a new franchise business. There are currently 30 stores in the United States. There are also stores in Australia and some parts of Asia. But they started building in the United States in 2018, expanded in 2019, hit a wall in 2020. But now that growth is starting to resume again. And I think by the end of the year, we should have, we're at about 32 now. There should be about 50 or more stores in the United States by the end of the year. I would be the second store in Massachusetts. There's already an X Golf in Wayland. That's doing very well, and I would expect that within the next year there will be other locations in Massachusetts. The concept, we have 7 indoor golf simulators, and on these simulators you can either do training. We'll have a PGA professional on staff that will give golf lessons individually and group lessons. There's also a driving range option where you can hit in, a driving range kind of format and watch how your ball tracks, the trajectory of your ball, how it tracks to, and other data on your swing statistics and data. But I think the most fun is that the system includes, right now there are about 30 different golf courses from around the world that you could load in what would be considered sort of a virtual reality or augmented reality type of format. You can play these different golf courses from around the world right in the comfort of 10 Wall Street, Burlington. Never have to worry about rain, never have to worry about snow or sunburn or anything like that. So and the way it works is in each simulator there are sensors and detectors that detect the club head speed as you swing through the ball. It detects the rotation on the ball and determines where the ball is going to go after you hit it. So you'll be looking out at a fairway and you'll watch your ball track towards whatever point of the fairway the data says your ball's going to settle. Then the camera moves to that location and you subsequently hit the ball until you hole it out on the green. It does include putting as well, so you have to putt it into the hole before you can take a score. Playing 18 holes of these famous golf courses, which would include, if you're familiar with golf, courses like Pebble Beach in California, St. Andrews in Scotland, and Bethpage Black on Long Island, many other famous golf courses. 9 holes of golf would probably take 1 or 2 people 1 hour. 18 holes will take about 2 hours. And with 4 people, it might take about 3 hours to play 18 holes of golf. Many golfers, when they play golf, they like to have a snack, and they maybe like to have a little bit of their favorite beverage to enhance the experience. So we will be operating, with as you see the menu, it's somewhat limited, but healthy food available. And with that would be full bar with beer, wine, and full liquor license.
Thank you very much. Oh, can you get a hole in one?
You can. I've never done it there, but I know it's been done. So yes, and if you come in there to play, I hope you make your name on the plaque, because we'll put all the hole in ones on a plaque on the wall. How's that?
Thanks.
Mr. McSweeney and I are most interested in the 19th hole, for sure.
Okay, well, don't tell the Board of Selectmen that, because they had a lot of concerns about the liquor license, but I think we'll be fine.
Well, thank you very much for joining us, and you're all set. And Marlene, will you be sending something to him?
Yes, what I'll do is I'll email you the approval letter and then I'll mail you a hard copy, John.
Okay, Marlene, thank you very much. And again, thanks to the entire board and all the participants here. I appreciate your support and I look forward to seeing you. I think you did ask and I never answered, when will I open? The goal is to open September 1st.
Thank you.
So that will be the plan, but I'm sure we're going to see more of each other before then.
Welcome
you
to
so much.
Burlington.
Thank you
Yeah.
very
Thank you
much.
very much.
Welcome to
Welcome.
Burlington.
Thank you.
very much. Take care.
Thank you.
Bye.
Our next agenda item is reorganization of the Board of Health. With the permission of my two colleagues, I think we should postpone that again since there's only the three of us. Could I have a motion to postpone?
Mr. Chairman, I'll just make one comment that I do think it's important that we do reorganize. And, I'm happy moving forward with the vote with just the three of us. But again, I'll follow the chair's decision. But I do want to throw that out there as a possibility.
Well, I appreciate that, but it's the optics of the three of us. I think we just hold off. It would be okay. Would someone please provide a motion?
Mr. Chair, I'll make a motion to postpone the reorganization of the board until there's a full board present.
Second.
I have a motion and second. Do you want to make, should we wait for a full board or at least four out of, well, we'll leave it at that. Any other discussion?
So and that's a good clarification. And I know it's semantic, so I don't know if this really matters, but I just, can we just make a motion that we continue this to the next meeting?
Mr. Chair, I'm happy to augment my motion to table postpone the reorganization of the board until
Next time?
period.
Next meeting. Thank you. And you second, Mr. McSweeney?
Second.
All in favor, Mr. McSweeney,
Aye.
Dr. Salzman,
Aye.
and I vote aye, 3-0-0. Thank you so much. Staff reports. I think this is a record. I'm going to start with the health agent, and it is so nice to see you in person providing a report. So thank you so much.
Thank you. So I just want to let the board know that tomorrow afternoon, we are offering a pool operator seminar virtual. So I'll be conducting a PowerPoint presentation. We have about 18 to 20 people who have signed up, and we sent out the link to join the meeting. And I'm looking forward to it. So we're covering some of the current COVID requirements, as well as review with the pool operation and the water testing. And I'm also working on inspections of mobile food trucks. I have 3 scheduled this week. And the food inspection, Samantha and I, as I mentioned at one of the other meetings I attended, due to COVID, we're trying to at least get one inspection done at each food establishment. The only exception there are the corporate cafeterias, which haven't been open for almost a year now, but everybody else trying to get in there. So we'll have that completed at the end of May. And then June, we're reserving for inspections of pools and camps. And then July 1st, that starts our new fiscal year, 2022. And we'll be back on our regular routine food inspection schedule at that time. So everybody, with the exception of the small retail stores, everybody will get 2 inspections. Fingers crossed.
Thank you, Marlene. Do you have any questions, anybody?
Mr. Chair, if I might.
Okay.
Sure. Please.
Marlene, so I don't want to be a Debbie Downer. And as somebody who grew up in a pool in Los Angeles, pools, especially indoor pools, humid environments, a lot of droplets, a lot of exhalation. I actually looked. I didn't see anything on the CDC or Mass DPH website about pools in the era of COVID. So what are the thoughts moving forward for pool operators, especially indoor pool operators, with regard to the pandemic, assuming continuing to wane?
So it's interesting that you said you couldn't find it online, because I couldn't either. It's actually under another segment through DPH, and there are guidelines out there. And for the indoor pools, yes. And I believe, Sarah, correct me if I'm wrong, I think we posted those on our website, did we? If not, we can do so. But they're very specific as far as the social distancing and the indoor pools. It's recommended that they actually reserve time for people to use the pools. And a lot of the hotels, that's what they're doing. They will allow the use of the indoor pools, usually by family. And then they give them a certain amount of time. You could be in there for a half hour, 45 minutes, an hour, depending on how busy they are.
Got it.
So, and that's what they've been doing during COVID. These special purpose pools, the spas, the whirlpools, those have not been allowed to open. And I believe those will open for the first time August 1st, depending on the vaccination rate and the COVID cases as we move along. So the governor, right now, you probably have heard, so the governor's looking at August 1st for the special purpose pools.
No, thank you, Marlene. Does that also include places like Lifetime Fitness?
Yes,
Okay. Thank you.
you're welcome.
Mr. McSweeney?
Yeah, thank you, Mr. Chairman. So Marlene, I noticed, so I guess this is a twofold question. I noticed that you're working with the new restaurant Parm that's opening up. I'd be curious to understand where that's going. And then the second part of that is, when we went through town meeting for approval for the associate director's position, there were some comments made that, restaurants would be closing because of COVID. And I think we're seeing the exact opposite, or at least not that trend. So maybe you can give us a snapshot of some of the new licenses of restaurants that are coming into town in the short term. Would be great.
Sure. So right now, the Burlington Mall seems to be the hotbed of restaurants coming to town, and that's where Palm is going. Palm is going at 75 Middlesex Turnpike. That's the old Sears on the first floor. There's going to be probably two other restaurants that are going to be going in there too. One is a Brazilian restaurant that'll be coming. And we also have, in where the Burlington Cold Cut Center used to be, we have a halal snack shack going in there. The Mediterranean restaurant just opened up at 390 Cambridge Street. That's as you cross over, just before you cross over into Billerica on the right-hand side. Right. So we've been quite busy. We've been quite busy with some of the new restaurants opening up in town. So
yeah, that's great. I think, like I said, I don't recall any closures in town other than, I guess, the Burlington Cold Cut Center, but we have one that kind of on their heels. So we're not seeing that trend in Burlington, which is great. I think we're hopefully going to recover economically sooner. Go ahead.
The only thing I'm not sure about is what's going to happen with these corporate cafeterias.
Yes, yeah,
there's a lot of them. There's
there?
probably at least a dozen. Right. So I'm not sure what's going to happen if they're going to open up. A lot of people are working from home, and they're going to stay working at home.
Right.
So that remains to be seen.
Gotcha.
I mean,
thank you.
I have to tell you, I'm very proud of our community partners who are running these restaurants. I'm sure other members of the board, we've really tried to solicit our community's resources and make sure that folks knew that we were interested in their maintaining their place in our community. And I'll just say for no other reason except that it was noteworthy to me. My family and I went to Yard House. Everything was just so appropriate for this time, and yet they managed to create such a pleasant atmosphere that it just was, it's a tribute to what our community partners are doing. And I wish to just officially, from the Board of Health point of view, thank our community partners for everything they've done during this pandemic. And I can only expect that it's going to bring back, multiple benefits subsequently.
And Marlene, I said to you earlier, it was nice seeing you at a live meeting, and I just want you to know, we know how busy you've been. We know how much you and your colleague have been doing to the restaurants, and I can tell you, I never had a worry because I knew that Marlene Johnson, our health agent professional, was there and taking care of what needs to be done. Never even crossed my mind, not even a worry. I just want to thank you on behalf of the board itself. Thank you for all that you did over the last year and a half. I know I've told you face to face when I really come into the office, but I wanted to do that publicly. Thank you for everything you do, Marlene.
Thank you.
Here, here.
Do I have a motion to approve the health agents report?
So moved.
So, second.
I have a motion by Dave McSweeney, second by Dr. Wayne Salzman. All in favor? David McSweeney.
Aye.
Dr. Wayne Salzman.
Aye.
And I vote aye, 3-0-0. Environmental engineers report. Christine Mathis, thank you.
Good evening. I want to remind the public that this Saturday, May the 1st, is our household hazardous waste collection event. It'll be our second that we've done under the umbrella of COVID. And it's in the usual place and time, Saturday morning at the Francis Wyman Elementary School, 41 Terrace Hall Ave, open to the public 8:30 to noon. And I do want to remind people who will be participating to please stay in your vehicle at all times and to put all of your waste materials in the rear of your car away from other items, so that, your trunk or your truck bed, back of your SUV, the rear part of your vehicle. We encourage participation. We look forward to a busy event.
Thank you. Are there any questions for our environmental engineer?
Just one comment, Mr. Chairman.
Please.
So Christine, I noticed that you received the list of hazardous waste materials from Northeastern University and I guess it's the Woburn building, and which I think is great. I didn't think they wouldn't send them in, but I just want to make comments since we had that large discussion going back a couple of meetings ago. So thank you for following up on that.
Sure.
Just to add a little bit more, we were going to think about talking to town council about our responsibility because when they dial 911, if they ever had to, hopefully they won't, but it'll be our fire and police departments. Would we have to go to town council to clarify any of those issues?
I believe Susan has already reached out to
Susan?
town council on this.
I just want Susan,
Yeah.
if you know.
Yes, I did. So I did email town council. I gave her all the information. She's currently still looking at it. She said it's a tough question and they're going to have to look into it more deeply to figure out, okay, should they get permitted in Burlington or not? So she's looking into it now.
Thank you. I have one other question, but if Mr. McSweeney or Dr. Salzman have any?
I'm all set, thank you.
Did we mosquito spray by helicopter?
That was scheduled for last week into this week, and I believe they did. I believe they did some last week.
Okay, thank you.
Yep.
I have no other questions. If not, I'll ask a motion to approve the environmental engineers report.
So moved.
Second.
I have a motion and second. All in favor? Dave McSweeney,
Aye.
Wayne Salzman,
Aye.
and I vote aye, 3-0-0. Director of Public Health, and as what we have done in the past, we have actually actually three reports. One is our Associate Health Director, Health Inspector rather. We have a supervisory nurse, and then we have the director's report. I'd like to take the individually, our Associate Health Inspector. Does anybody have any questions? We can vote on them all together. Okay, I'll move on for that. How about our supervisory nurse?
Mr. Chair.
Yes, please.
So, Director, the flu season is coming to an end. What's our final tally for what we have left?
So I don't know offhand the exact amount, but we do have an amount that we're going to need to return, and it is more than the 20% that we will get for reimbursement, but not too much more. So we had a bit of a loss on the flu vaccine this year. We will get that 20% back, but so it's more than we have returned in previous years.
Yeah, totally unique season. I am anticipating that next year will be back to what we expect.
I
Any
hope so,
questions?
because did reserve flu vaccine for next year. And we as we talked about at a previous meeting.
Thank you.
Mr. McSweeney, David, anything?
Not on the supervisory nurse, no.
Okay, Director of Public Health, we'll vote on them all together. Are there any, Susan, do you have anything that you'd like to?
Just a couple of things. I'm sure you all saw the announcement today with the new dates from the state. We are expecting the COVID standards to change in response to that, but the thing is, we don't know when. So we've had a lot of businesses calling up, asking questions about, for example, the office standards, what's going to happen now. We don't know exactly how those standards are going to change in the next few weeks. We just need to wait until the state comes out with the new standards. So that's what we're doing now. So if anybody has any specific questions about the standards, we're following the current standards that are out now and are expecting those to change. Also, too, I just wanted to make a note. We have over 300 Burlington Volunteer Reserve Corps volunteers now. So Katie is finally catching up with all the volunteers that came in, and we have almost all of them in the system at this point. So she's doing a great job in keeping up with all the new volunteers, doing all the queries, getting them their badges, getting them the information they need.
That's just outstanding.
Yeah, how did we go from, I think we had like 175 up to over 300? Was it probably because of COVID, right? But
Right.
yeah, that's
That's
crazy.
a good,
That's great.
that's a good number for town meeting. Thank you.
Yeah, and also very
Yes.
proud of the community in stepping in like that too.
Very
Participating.
proud
That's
of
great.
you.
Yeah.
Do you have anybody else have some questions? I've just got one.
I just have one, Mr. Chair, on
Please, go ahead.
on the high school. Susan, I guess he's not Dr. Larkin. Mr. Larkin came before us last meeting. How did that kind of quote unquote reopening go? I think probably it was this week, or was it last week?
So the middle school and the elementary schools, they were in last week. Last week was the April vacation week. The week before, the high school had stopped, but the middle school and the elementary schools had kept going. So the high school was out for basically 2 weeks, started again this week. And then after, this is the first of them coming back after April vacation. I will say, since our last meeting, the number of cases have gone down. So it seems to be, getting less every day, which is great. Hopefully we won't have any more cases, or at least at the numbers we were seeing before in the schools. So I think that's a good sign. There is more guidance coming out from DESE in light of, I guess, the governor's new orders or dates. And we are going to be reviewing those. We've had some questions from the schools that Christine Mathis is working on as well. And there's also questions around, how we're going to quarantine and things like that. So this has brought up, the change in dates, brought up a lot of new questions that we're looking for answers for now, especially when DESE and Department of Public Health are not always clear on how they want to move forward.
Gotcha. Thank you. Thank you for that update. That's great. Thank you, Mr. Chairman.
Yeah, I just have one question. There were some clusters in town around some from school clusters. Has that been resolved, Susan?
Yeah, well, the clusters, they have been all along and are, continuing. Cluster means that more than 2 people are positive because of any one exposure event. So we've had those in town, and yeah, they're pretty, right now, I don't think we have any current clusters going on, maybe 1 or 2. And some of those also get investigated by the contact tracing team. So what happens is if there's a business in town and, the people live in another community, the contact tracing team is doing the investigation, and then they will notify us if there's something going on at a business in town, because businesses are still required to report to us. And it's a good idea for them to do that, because we can help them through it, make sure everyone gets in quarantine and that they're adhering to the proper procedures.
There were supposedly some programming, some parties and barbecues and other things. Were those all appropriate based on your complaints?
Programming. So the programming from, I'm not sure what you're referring to.
There were some parties that you noted that there were some people who attended that were inappropriate.
Those that I believe was speculation from the high school. We did not have direct knowledge of any of that happening. So we just knew that the cases were upticking, did not know the reason why.
Thank you. Do I have a motion to approve the Director of Public Health report, which includes the supervisory nurse and the associate health inspector?
So moved.
Second.
I have a motion, a second. All in favor, Mr. McSweeney,
Aye.
Dr. Salzman,
Aye.
and I vote aye, 3-0-0. Before we conclude, I'd like to say something and about the issues and the pandemic that are taking place in India. We have a lot of community members in Burlington who have family in India, and we want to express our thoughts and prayers from the Board of Health. I know that our board members, specifically Dr. Wayne Salzman, has brought that forth to us and brought it forth to me, and I want to appreciate that. And Doctor, you have anything else to say? Or
No, Mr. Chair, you said it perfectly. Our thoughts and prayers are with our community members who have family suffering and from the travesty of COVID-19, and we wish them all well.
we ask our community at large, those our friends and family within Burlington, to please keep those in India in their thoughts and prayers. Thank you. If there's nothing else to discuss, if Mr. McSweeney or Dr. Salzman or anything else, I can take a motion to adjourn.
So moved.
Second.
I have a motion and a second to adjourn. David McSweeney.
Aye.
Wayne Salzman.
Aye.
Ed Weiner, aye. 3-0-0. Thank you so much, and thanks everybody for being there. See ya Saturday morning, bright and early, with your household hazardous waste and no latex.
I don't know if that's how I want to end the meeting, Wayne. I mean, Ed.
No. Dr. Salzman has to tell everybody, as we have closed every meeting for multiple years.
Everybody, please, 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 wash your hands. Wash your hands. God
Thank you
bless you.
so much. God bless
Have a
you.
great
Good
night.
night, everybody.
Good
Bye.
night.